So this is V3 and we're talking about chemotherapy. What class of chemotherapeutic agent do you know? So chemotherapeutic agents depend on the cell cycle. So G0, G1, S and G2. So phase-dependent drugs kill cells at lower dose, act within a specific phase of the cell cycle. And examples include methotrexate and vincristine, vinblastine, and non-phase dependent drugs kill cells exponentially with increasing dose and equally toxic for cell within the cell cycle or G0 phase. Examples are alkylating agents, cyclophosphamide cisplatin, 5-fluorouracil, and anthracycline doxorubicin. How do chemotherapeutic agents work? So different group of drugs, class of drugs act differently. If we talk about bleomycin, it inhibits the DNA polymerase enzyme which causes the breaking of the single-stranded DNA. Similarly, doxorubicin, which inhibits RNA synthesis, cisplatin, which inhibits the DNA synthesis by cross-linking DNA strands, methotrexate, which stops the enzyme dihydrofolate reductase, vinculcular, which inhibits the tubulin in the metaphase of the mitosis. What side effects occur with chemotherapeutic agents? So we divided general and the specific. In general, there are 5, which are gastrointestinal toxicity, nausea, vomiting, bone marrow toxicity, alopecia, infertility, and the specifics are pulmonary fibrosis by bleomycin, hemorrhagic cystitis by cyclophosphamide, cardiomyopathy by doxorubicin, hepatic damage by methotrexate, and skin pigmentation and 5-fluorouracil, and peripheral neuropathy with oxaliplatin. How do alkylating agents work? They react with the DNA to form the covalent bonds, causing single-stranded or double-stranded DNA breaks and cross-linking. They are used for hematological and solid organ malignancies. There is a steep dose response curve. Examples include chlorambucil and mitomycin C. What are the heavy metals agents and how do they work? So platin. So platin-based cisplatin, nephrotoxic, carboplatin, oxaliplatin, activated intracellularly to form reactive intermediates that form covalent bonds with the nucleotides from DNA crosslinks. What are the antimetabolite agents? These resemble naturally occurring purines, pyrimidines, and nucleic acid. They inhibit key enzymes involved in DNA synthesis and incorporate into RNA and DNA to cause strand breaks. They act at the S phase of the cycle. Examples include methotrexate, 5-fluorouracil, and gemcitabine. What are the aims of chemotherapy? So inhibit one or more processes involved in the cell division and cells die by apoptosis. Treat advanced cancer. Best response may be reduced in tumor volume. This may be palliating by prolonging the survival or improving this pressure effects symptoms control. Cells can develop resistance from acquired mutations. Treatment for early primary cancer as an adjunct to surgery. It is routinely offered to those at high risk of recurrence after surgery, bowel breast cancer. What are the limitations of chemotherapy? So cell proliferation mechanism affect normally the dividing cancer cells. Selectivity towards the cancer cell is seen as some tumors are highly proliferative compared with the normal cells. So the lymphoma are defective in their ability to repair DNA and therefore cannot repopulate. Therapeutic ratio, toxic dose and therapeutic dose for a drug should be close to the 1 so that damage to normal tissue is self-limiting. Drug-induced damage to normal tissue that is rapidly dividing bone marrow GI can be life-threatening. Are any malignancies fully curable with the chemotherapy? Yes. So chemotherapy curable diseases are teratoma, seminoma, high-grade non-Hodgkin B lymphoma, Hodgkin lymphoma, and Wilms tumor. And chemo-resistant tumors are melanoma, renal cell carcinoma, and hepatoma, cholangiocarcinoma. How is chemotherapy delivered? So either delivered in combination or high dose. In combination, use different classes for broader coverage of activity and reduce the risk of resistance of clones. And high dose given the steeper part of the sigmoid dose response curve. What are the biological agents? These are the novel class of systemic anti-cancer drugs with a highly specific target. Example, monoclonal antibodies raised in either a mouse or a human which target extracellular receptors such as the cetuximab, inhibiting the epidermal growth factor in colorectal cancer.